The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. You can find out more about us by visiting our website, apmrmiami.com, and by following us on Facebook and Instagram at apmrmiami. As always, our purpose is to educate you about the various ways that the body can regain its innate ability to heal without the use of drugs or invasive surgery. Today's show is pretty special to me because I have a patient and also a close friend. He is a flight nurse of the year in Monroe County, fire rescue. He's a 4-time Phoenix Award recipient for successful resuscitation of a cardiac arrest patient, leading to hospital discharge and carrying on of normal activities and a full life. I'm here with Roger Torres. How you doing, Roger?
Doing great. Thank you for having me.
Fantastic to have you here. And as always, I'm here with our amazing office manager, Rob. How you doing, Rob?
Doing very good.
This is a pretty near and dear topic to my heart, Raj, because when you came into our office, you had a pretty devastating injury to your shoulder.
Yeah.
But before we even get into the injury to the shoulder, you have an amazing life story in general. Why don't you tell us a little bit about that?
Well, about 6-7 years ago, I was getting ready for a freediving competition. I do avid spearfishing and freediving. And about a week before the competition in the Bahamas, I went ahead and had a appendix rupture. And I had been training very hard for many, many, many months, almost up to a year. And everything fell apart. And that really struck me mentally, emotionally, and obviously physically. And I kind of lost my edge, and I will be honest, I kind of picked up bad habits, started drinking more than usual, started smoking, and pretty much I was someone in a lost. I was in a spin for about 6 years. During that time, also unhealthy eating, no exercising, and I was always somewhat fit, obviously, because of the hobbies that I do. Mm-hmm. And I ended up blowing up to 330 pounds.
In fact, you just sent me some pictures of what you used to look like. I showed them around the office. No one knew who it was. Everyone knows Roger in the office. No one was able to guess who that was.
I still don't believe it's him.
Yeah.
So, a good friend of ours, Travis, gave us a saying. He said, there's no better place to build a strong foundation than when you hit rock bottom. Yeah. I imagine that was rock bottom for you.
I did. I certainly hit rock bottom. It's even to this day, I think about how low I got, the point how low I got in, it still tears me up at times. It cost me a lot of times in my, relationships with, bad times with my wife, my kids, my parents, my family. I was just not myself. And they knew that. They knew something was going on, but I was always very quiet about it. And until one day I just said, I'm done. I'd rather be dead than live another day like this. And from that moment on, cold turkey, I stopped drinking, I stopped smoking, and I completely turned my life around. And, yeah, thank you. I appreciate it. Yeah. And I've never looked back. It's been the best decision of my life.
And just, people out there don't know who you are, what you look like. If people come and see you in the gym, you are the picture of physical fitness. I mean, shoulders are much wider than your hips. Yeah. Tailored legs are huge. You're going to be competing next year? Do you pick the show?
Yeah, well, I'm in the process. I'm in between two shows right now. I haven't decided yet, but that is my goal. And as you know, I'm heading in that direction quite rapidly.
And you went from 300, was it 330 at your max?
I went from 330 pounds down to 164.
Wow.
And I've done that over the lifespan of 3 years. With again, just it all starts mentally. Yep. Everything's connected mentally, emotionally, spiritually, and physically. It's all intertwined together. So it starts at the top, and whatever is inside, like what you read about all the time. What the mind believes, the body will follow.
And you took
everything else.
You took that to the next level. You started training like there was no tomorrow.
Honestly, I became relentless. My nutrition, my exercise, my relationship with my wife, my kids, my parents, everything, my coworkers, and mostly within myself. I stopped believing my lies, and again, I said enough is enough, and here I am today.
And that leads us into how we first met.
Yes.
And that relentless training led to a pretty catastrophic shoulder injury, and it's a great story about how you mentioned to Rob and to our good friend Danny, how you even came to see us. So how did that happen?
Yeah, so in the process, last October of last year, I decided to start putting on some muscle mass, and I started working out, and I came back with a vengeance within myself. It's just my mentality. When I do something, I do it 110%. I don't listen to anybody, because if I did, I probably wouldn't be at the level that I am today. I mean that in a very humble way. But I came back, and I think I came back a little too hard. Because of the way I used to train before that. And within a matter of about 3 months, I put 22 pounds of muscle, dropped my body fat to 7.8%, I think it was. And in the process, looks like, I'm 45 years old right now. So it looks like my shoulder had a hard time trying to keep up with me. And even though I had telltale signs that something was going on, as my buddy Danny will tell you, which thanks to him, I found you. I worked through the pain and all that until one day I just couldn't move my arm anymore. And
it's an important thing for everyone to realize, is that when you get these warning signs and you are in good shape, you just don't want to stop. And that's what makes these injuries so difficult to treat, because by the time we actually get to see you, and we have an MRI, we're going to talk about that. It's very, very severe in terms of the actual damage that's occurred that's producing the pain. Yeah,
I mean, again, it's a mentality I came back with. I'm going to do something, I'm going to do it 110%. And it becomes somewhat of an addiction when you get to the emotional, spiritual, physical level that I live every day. Live my life every day with.
So you got to the point, couldn't move your shoulder, and you sought some physical therapy. You actually tried to help yourself.
Yeah, I went to another facility. And I did a bunch of stuff. I did deep tissue massage. I did cupping. I did dry needling. And it just wasn't, and the problem kept coming back. We just couldn't figure out what was going on. And in between all that, I was still trying to work out, which wasn't probably the best thing, until, again, I had the devastating injury that occurred in the gym. And then I went to go see you. I hadn't slept. I was unable to sleep. By the time I got to see you in January, I couldn't sleep more than 4 hours straight for already 3 or 4 months. I would wake up at 3 o'clock in the morning with this excruciating deep pain shooting through my back, my shoulder blade, my deltoid, my elbow, and I would be pacing up and down the house. And I have no problem saying it, but as a man, I would tell you, I even at times even shed a couple of tears, because there was nothing I could do about the pain and the anxiety that I was experiencing.
We mentioned a couple of shows ago that oftentimes when the pain becomes so intense, we'll have people that take these non-steroidal anti-inflammatories, Motrin, Aleve, ibuprofen, and the recommended dose on those medications, when you read the back of the bottle, it says don't use for longer than 10 days. But they sell them in quantities of 1,000.
Right.
And they're made for people that, that have these injuries that start to take them and become reliant on them. And that's what happened to you, Raj.
Yeah. It was one of those. I was buying a bottle of, I believe it was 200. And that would last me about 3 days. And honestly, it would only take the pain for maybe 30, 40 minutes. And then the rest of the day while I was awake, I was just in pain constantly, but I was popping them like candy. So imagine how many I was taking, probably 600 to 800 of them a week.
Wow.
Yeah.
Incredible. And 800 milligrams is a prescribed dose that can only be written by a medical doctor, by a mid-level, and filled at a pharmacy. That's how strong that dose is. And the side effects that come with that, you're really, really lucky.
Yeah.
Because the side effects that come with that are attributed to the 16th leading cause of death in the United States, which is gastrointestinal bleeding. You know all about that.
Right. Yeah. Yeah. It was, I'm real lucky. I thank God also for the side of that. I eat and live very clean now. Like I said, I don't drink, I don't smoke. And, I keep my nutrition at optimal level. But, that's probably would give me the extra edge. But every time that I would take a dose, I was taking 3 to 4 of them at a time. Mm-hmm. So that's 600 to 800. Yeah. So imagine. And sometimes I do that within 2 hours. Multiple times.
Yeah, we're really, really fortunate to have you here, and that everything turned out the way that it did. And I remember when you came into the office, I wasn't seeing you initially. You got to work with Dr. Ben, and you were doing some physical therapy, much the same. And I remember you telling me you were making some progress, but then you'd have one step back, and the pain just started to become more and more intense. And Dr. Ben went ahead and ordered that MRI.
That is correct. Right. So I went for the MRI because I remember telling Dr. Ben and yourself, I said, listen, there's something going on here, and it's something a lot worse than what we think. And so I went for the MRI, barely got through the MRI. I was so much in dire pain, I was tearing up in the MRI. I almost could not complete it. They almost made me reschedule to come back and get pain administration in order to do that. I mean, that's how bad the pain was. And once you gave me the results, my jaw dropped. That's when I knew.
And I think it's important that we share what those results were. And the impression, when we get MRIs back and we read these discs, the reports that we get from the facilities are usually a couple of lines long. And yours was the better part of 2 pages here. And the impression said severe glenohumeral arthritis. And that's the shoulder joint. For a 45-year-old to have severe arthritis is not common.
Right.
And severe glenohumeral arthritis was the number one impression. We had supraspinatus, tendinopathy, and tendinosis. So that tendon wasn't functioning normally, wasn't recovering, wasn't repairing. And that's the tendon that brings your arm out away from your side.
Right.
We had infraspinatus, tendinopathy, tendinosis with tearing at the myotendinous junction. That's, for anyone that's ever thrown a baseball, that's the ability to bring the arm back and throw. So you can bring your arm out and to the side and back. You had supraspinatus tendinopathy, and then diffuse degenerative labral tearing, if that wasn't enough. And the labrum is the connective tissue that holds your shoulder onto your shoulder blade.
Yep. And that's the major injury was my shoulder almost popped out the week before I went to see you, working out with my partner, Danny. And
you went for a review of the findings on the MRI. For a consultation, and what was some of the things that they told you when? Well,
I said from yourself, they said, very simple. They were straight up. They're like, there's no question about it, you need a shoulder replacement, and there's no other way to go, around this. Your MRI results was so devastating for your age and so forth, and then I was like, wow. So I obviously went to you, and then you mentioned to me about the stem cell. I'd heard about it, but I really didn't know too much about it, And once you told me, they told me if I had a shoulder replacement, I'd be out of work for 3 months, and back to somewhat normal within 12 months. And I'm like, wow.
And that's best case scenario. That's if everything was perfect.
Yeah. So and then Dr. Joe, you spoke to me about stem cell, and to me was a no-brainer. It was a no-brainer.
Yeah, and one of the things that we discussed in was, number one, your age, and the fact of the way that these implants are designed is they're meant to last, with technology as good as it is today, about 10 to 12 years. Now, that doesn't mean that the joint is going to fall apart and you'll have to replace it over and over and over again. But in terms of the relief that it provides, it's about 10 to 12 years. But there are times that the joint does have to be resurfaced and, in fact, replaced. As far as being competitive or being able to bodybuild again, that pretty much would have taken that off the table.
Right.
If you think about some of the athletes that have had hip replacements, Bo Jackson's the one that comes to mind. That's the era that I grew up. One of my favorite athletes to watch. Amazing football player in college, all the way up into the pros, baseball player. He got his hip replaced at the peak of his career, and he was able to come back and perform for a while, but it took him out of the game. Mm-hmm. And that's really what happens when you have these devastating type of injuries that lead to degenerative disease at any age. And that's one of the reasons that we talked about these biologic allografts that contain the stem cells and even how they work in your body. And one of the things that was so important to me was you had this chronic inflammation. And inflammation is a sign that there is a problem, that there is a reaction in the body that you're incapable of dealing with. Your body is just incapable of healing. And chronic long-term inflammation tells us, in terms of stem cells, that you either don't have enough of them or the ones that you have aren't working sufficiently. And that's what results in this long-term inflammation. And the fact that you were taking anti-inflammatories really defeats the purpose of how these stem cells are designed. Stem cells are drawn towards inflammation. Where you have the most pain, where you had the most arthritis is where those stem cells are moving. And because of the location of where the injury was in fact one of the reasons why they couldn't do what they were supposed to do. We mentioned in our last show that lower backs, necks, hips, joints, and shoulders are the most difficult injuries to recover from as we age because of the location of that injury. Surface injuries always heal. You scrape your knee, you cut your arm, bursitis, tendonitis, they heal pretty quickly. But herniated discs, labrum tears, meniscus injuries don't heal. And it's because they are positioned in an area of the body where there is not a lot of oxygen. And even though your stem cells are migrating and moving towards that area in high quantities, the fact that you don't have enough oxygen present prevents them from releasing these molecules called growth factors, which is what your body then utilizes to start engineering the repair of this tissue. And one of the unique things about our protocol was that we address both of these deficiencies. We found a way with an amazing product that we're able to incorporate biologic allografts that contain these mesenchymal stem cells, hyaluronic acid, over 3,000 different types of growth factors, and we combine them with ozone and prolozone, which is a form of activated oxygen that we inject into the joint with the tissue graft. Once we did that, Raj, what you experienced was even more than you could have imagined.
Yeah, it certainly was. I mean, I went from as simple as opening a glass jar, opening the car door, reaching for something to grab off the shelf. I couldn't do that. Brushing my teeth, I couldn't do that.
And it's an amazing story. We're gonna hear all about it. We're gonna take a break, and we'll be right back. All right.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
So again, we're sitting here with Roger. He's a great friend of ours, great friend of the practice. We become close friends and on our way to becoming workout partners.
Yeah.
We were in the midst of talking about this pretty life-changing, devastating injury that you had with tearing to the labrum, diffuse degenerative arthritis in the shoulder joint, and your journey to help recover non-surgically and without the use of pain meds.
Yep.
We also spoke about how we introduced these tissue grafts that contain mesenchymal stem cells and prolozone into the joint. And your pain initially was about a 10 out of 10. Is that fair to say?
Honestly, it was more than a 10. And that's without exaggerating. It was more than a 10.
And there are lots of people out there that are concerned and they hear about stem cells and they just think, you know what, there's not enough research out there. I don't know anyone who's done it. It's not going to work for me. Why did you feel so comfortable doing the procedure with us?
Well, for several reasons. Once I did, with everything, I did my own research as well, and I saw all these, even throughout the world, all these different results that people were getting. But the fact that you sat down with me and
on his day off.
I'm sorry?
On his day off.
On his day off, by the way. That's right. On his day off, he came in just to speak with me. So and you took your time, you explained everything, you pretty much just dissected everything. To me, it was a no-brainer. I mean, it was just, for me not have to take time off work, just, obviously be careful and follow things by the book under your strict direction. The results were just phenomenal. I mean, I'm so ever grateful. I felt relief within a week.
And that's the two goals that we shared.
Right.
In order to have a successful outcome, we have two goals. We like to say burn the candle on both edges. We want to absolutely decrease the pain as quickly as we can.
Right.
And we want to do it non-surgically without drugs, but we also want to improve function. So those are two separate things. And one happened faster than the other. So about the pain. How did that go?
Well, again, within a week, the pain reduced probably to about 60%. I was down to about 50%. I was at a pain level usually about 80% throughout the day. That reduced to about 50% within the first week. I also, which I still can't believe it myself, I stopped taking anti-inflammatories. I stopped taking the Motrin for not only the stem cell reason part of it, but also I just didn't need it anymore. And the pain was, quote unquote, tolerable, where before it was debilitating. So, and again, along with that, the protozoal shots were definitely a big benefactor to that, And
really, that's what takes it to the next level.
Yeah.
Prolozone,
without a doubt.
Prolozone, for anyone that doesn't know, is when you take medical grade oxygen, run it through a generator, you come up with a gas called ozone. And it's amazing in its properties that it's antimicrobial, antifungal. And when you inject that into the joint, it's a very unstable gas. And one of those molecules of oxygen will jump and stabilize free radicals inside the joint. It helps reduce pain receptors inside the joint. But the energy that's created when that molecule jumps is one of the things that stimulates stem cells to release massive amounts of growth factors inside of a joint where oxygen doesn't usually exist. And that's when your body starts to reduce the inflammation and you actually start to heal. Because keep in mind, if you are reducing inflammation using an anti-inflammatory for orthopedic conditions, you are stopping your body from healing long term. And the opposite happened. So your body started to reduce inflammation and you started to feel better almost within the first couple of days.
I did. I remember specifically, actually with Rob, and he said, "How are you doing?" I said, "I can't believe it." I go on the fourth day, I noticed already the relief. I know this is not psychological because I started to sleep, and I haven't slept it was 3 or 4 months. I hadn't slept more than 4 hours straight. So again, it was just, and even to this day, for me to say that at the 13-week mark, I pretty much have done almost complete recovery with my strength back, and living a normal life is just beyond me. I mean, at this point right now, I'd still be out of work if I had a total shoulder replacement.
And you said something to me that was very powerful when you started getting all this relief, which was your wife was appreciating it just as much as you were, because now you were tolerable. Now you weren't short-tempered. And, I remember you saying, my wife thanks Dr. Joe so much because, now I'm me again.
Yeah, that's the thing. I mean, I'm going to be honest. I got to the point where I was just intolerable. I couldn't even stand looking at myself in the mirror because I was just miserable all the time. And again, this affects your psyche, your mental, emotional part. And I was impatient. Many times with my kids or wife or my parents. Always you kind of like snap, and it's just like. But with the work that I do, I mean, I'm up sometimes for 30+ hours. Sometimes so if you're never getting enough sleep, you're going to become intolerable, even to yourself. So, yes, it definitely brought a somewhat of a normal life already back to back at home and so forth. But it's amazing what a lack of sleep can do to somebody.
And, watching you come into the office every day, it's not like, it's hard to find out how you're doing. As soon as you walk in, you wear your emotions on your sleeve. So I remember the first several weeks, I could still see it in your face. You were feeling better, but it wasn't where you wanted it to be. And then all of a sudden, one day, you came in and you were smiling.
Yep.
And you said, "I don't even know what to write down. I feel really good today." And we. It's really important to also note that we didn't just do this tissue graft. We actually looked at your shoulder blade. We worked on the structure. You're a chiropractic patient, and to your surprise, on one of these later visits, we found out that some of the weakness that was being caused in the supraspinatus and some of these rotator cuff muscles was actually coming from a pinched nerve in your neck.
Right.
And I think that was the beginning of where this whole thing originated with when you first had the injury.
That is correct. We again, you're like, I had so many things going on at the same time that you sat down with me and you're like, wait, we got to figure this out, and you started backtracking, like where this might have originated from. And because of my symptoms that I shared with you, you're like, this led to this one, this led. And I'm like, yeah, you're right on the money. I went from A to Z, and everything was just aligned until finally my shoulder just almost came off. So it was great. Honestly, I'm just very grateful for everything you've done for me.
And it's so my pleasure to do that. That's my purpose is to help not only close friends, but all of our patients to recover naturally, to get really the doctor out of the way and get the body back on track, healing itself. There's no greater drugstore, there's no greater doctor than the human body itself. And if you could be smart enough to repair the physical structure, get it back in alignment using chiropractic, decompression, and physical therapy, if you could replace these key nutrients and vitamins that your body has become depleted with over time because of injury and the overuse of medications, and recover some of the stem cell function that has been lost over time, all you have to do is get out of the way and let the body regenerate and heal itself.
I'm a big believer in that, and big believer in health. You give the body the nutrients, the water, the exercise that it needs. And not only just from a physical standpoint, mentally and an emotional standpoint, everything, like I said in the beginning, it's all connected. And I believe stem cells is one of those things. Give them the stem cells, give them the protozoan shot, let the body do the rest. But definitely follow the strict rules that you provide. And that's the other key point right there.
Join us next week to hear more about Roger's amazing road to recovery and his quest to become Mr. Florida. And stay tuned for future episodes where you will learn more about the different ways to repair your body naturally, on how to replace key hormones, vitamins, and stem cells safely and effectively, and how to allow your body to regenerate and heal itself without the use of drugs and unnecessary surgery. Remember, repair, replace, and regenerate. I'm your healthy host, Dr. Joe Gambardella, and I'll see you next time.